Hello everyone, my name is Yashi Gupta and I'm the founder at Vatashi. At Vatashi, we aim to provide you with clean air solutions. Our journey started in 2020 when the COVID pandemic made everybody running around for good quality face masks, which is when we had our technology tie-up with the prestigious Baba Atomic Research Center to develop a HEPA filter-based face mask for the scientists of our country. Which is when in 2021 we realized that good quality air purifiers and air pollution in general is a very big problem in our country which is not being addressed by anybody. Hence, we decided to launch Vatashi. On the occasion of the World Environmental Health Day, we will be discussing in detail the impact of bad air quality on the human health. Hello everyone, I would like to introduce you Dr. Shiv Gupta, who is the head of the cardiac department at Inlax in Budhani. Thank you so much, Doctor, for joining us today on this auspicious day. Okay. Could you tell our viewers a little bit about yourself?
I'm a heart surgeon. I've been doing heart surgeries, open heart surgeries for the last 30 years. For the first 7-8 years in England, Australia, Singapore, and now for the last 24 years in India.
Thank you so much, Doctor. You have such a wide experience in open heart surgeries. I would like to understand from you, what is your opinion about air pollution in our country today, and how do you think this is impacting the health on the human body?
Health pollution is a major problem in our country. It is affecting all organs of the body, but particularly the heart and the lungs. There's a notion that lungs are getting affected by pollution, but as a heart surgeon, I can tell you that the heart also gets affected in a major way because of pollution, especially particulate pollution.
Okay.
Lot of studies have been done, especially in America, where they have conclusively proven the association between heart disease and pollution.
So is there any particular disease that associates specifically with air pollution being a major contributor?
People who are subjected to pollution, the disease worsens, and the people who are recovering from their treatment, the treatment recovery is delayed, and many other complications can happen because of this pollution in these heart patients. There are other reasons also where some people have got what is called cyanosis, and where the blood is deoxygenated. In those patients also, in a major way, pollution can affect their outcome.
So would it be right for us to say that air pollution leads to an overall degradation of the heart?
Yes, absolutely. No doubt about it. Absolutely. There are multiple studies now to prove that heart disease actually worsens and because of pollution. And also the people who have on treatment, the recovery is delayed because of pollution. As a heart surgeon, I operate on the heart and look at the lungs very commonly. Every time we look at the lungs also while we are operating on the heart, and we can make out a difference. The people who have lived in the cities, in Pune, Bombay, the lungs are much blacker in color.
Okay. As
compared. Normal lungs should be absolutely pink. In India, in the cities, it's much more blacker as compared to the people who come from, say, villages. They come also over here for surgery, and those lungs are much pinker as compared to the ones who have been living in the city. So it has affected the lungs also, and it has affected the heart also.
Okay.
Yeah.
So what I understand from this is that basically, we use air purifiers, in our maybe our rooms, our recovery areas, with better airflow, with more cleaner air, that will help the person recover better from illnesses.
There's no doubt. How we purify the air is the issue. Whether we purify by reducing the pollution overall or by reducing the pollution around the patient or the person, it's important, because if somebody is in a room and the room is purified, at least he is not subjected to the pollution which is existent. Ideally speaking, the pollution should be controlled on a massive scale, but Having said that, it is not possible. So yeah, so that is beyond the domain. So what a person can do for himself is use a air purifier to purify or reduce the particulate matter,
limit the exposure.
To limit the exposure and help in the recovery in his heart ailment.
Great.
Also, I would like to thank you for taking this initiative and trying to educate the people about the dangers of pollution for the heart.
Thank you so much, Doctor. Now we have joining us Dr. Pradeep Funde, who is a leading chest physician associated with Inlax and Budani Hospital, also having his private clinic, Pearl Polyclinic and Dental Studio in Koth Road, Pune. Thank you for joining us, sir, today.
So thank you for calling me.
On this occasion of World Environmental Health Day, sir, we would want to understand from you, what is your opinion on air pollution in our country, and how do you think that is impacting the lungs of the human body?
So since birth, we continuously breathe. So we'll take air. If it is polluted, then that poses significant risk to respiratory system particularly. Though it has impact on other systems also, like cardiovascular system, CNS or other body parts. But main part, as it enters through your lungs, so it has the more impact on your lung. So usually what happens whenever you inhale polluted air, so that contains various pollutants like ozone, then some particulate matter, let it be of size 2.5 or smaller than that, or up to particulate matter of 10. So that goes up to your small alveoli and smaller airways, and then goes to your bloodstream. Also, those who are having underlying respiratory conditions like asthma, COPD, ILD, in that conditions also, if those patients exposed or those persons who are having respiratory disease are exposed to pollutant air, then there is increased risk of exacerbation, or because of repeated exposure, their immune system gets suppressed and they get repeated infections.
Okay, so since you mentioned that particle matters of PM 2.5 or PM 10, can I say maybe that if the particle size is less, it might be less damaging to the body, or is that again a myth that people have?
Yeah, it's completely myth. What I feel, whatever the smaller size, it goes deeper into the tissue, it's translocated through your alveolar, that membrane, and can even go to your bloodstream. So then that has the further effect that affects the other system also.
So we can say that maybe it would be right for me to say that a 0.3 micron particle matter would be more damaging than a 2.5 micron particle matter.
Yeah. You are saying it correct.
Okay. Because I feel a lot of people, they feel that, we have 2.5 micron filters in our air conditioners, we have 2.5 micron filters in our car, and they feel safe. But this is a study that even we kind of found, and, I'm really glad that, you are validating our study today, that the smaller the size of the micron, the more damaging it can be.
Yeah, it is correct. Because whatever smaller size is there, it goes more deeper. In simple words, we can say can translocate to your bloodstream also and have further damage.
Wow. So it won't be restricted just to your lungs.
Yeah.
It can then travel anywhere in your body.
Yeah.
So doctor, on the occasion of this World Environmental Health Day, would you like to share with our viewers certain myths, certain misconceptions that you have seen, in your patients in all these years of your practice?
So, usually people have various misconceptions about the pollutions. Like usually people feel that those who are having respiratory problems usually get more affected by pollution. It's not true. We can say that those having respiratory disease in them, exacerbation risk or worsening risk increases. But those who are having not having any respiratory problems also are equally affected by the air pollutions. So that one myth we have. Then other myth like usually people think that wearing mask give the full protection. Always wearing mask is very difficult usually, and if you wear N95, then that give protection up to the
95% of the particle matter, right?
Whatever that small size particulate matter is there, up to 2.5.
2.5 micron, right?
Less than that, usually it
You're still
won't do-
exposed.
Yeah, exposed to that. Second myth is usually people says that once you are inside the car, you are fully protected. It's nothing like that. So whenever you are commuting on polluted airway, so through exhaust or through open windows, and in that area because of exhaust gases
gas
from
is
the
being from outside
yeah,
the air
yeah.
that is pulling.
So you are not completely protected.
This was great, doctor. Thank you so much for your time. We've had such valuable insights from you.
Thank you so much.
Yeah. So as we discussed with the Dr. Gupta and Dr. Funde, we can draw a conclusion that it is very important of what air you choose to breathe. Bad air quality can severely impact your heart and your lungs, which is why at Vatashi we have launched the Ace and the Mini. Please go to our website to check in detail the features and why this product can really help you change your life. And join us in our mission today to choose what you breathe.